All right, we have the great pleasure of having Sergeant Tony Acuna from the Army National Guard, Oregon Army National Guard. He's going to go over with us his go bag, which is his medic kit. What do you call those kits, by the way, Tony?
We just call them our medic bags. We do have go kits, individual go kits that are specifically for the CLS people we train. When I mean by CLS,
for people that don't know CLS?
CLS means Combat Lifesavers.
Okay.
And they are our regular Joes that we train in the areas of learning how to bandage, stop the bleeding, basically stop the bleeding, start the breathing process of your ABCs and CPR. Airway and bleeding stuff is going to kill you out there. Is the
Terrence?
Come on in, Terrence.
I'm good. What's going on?
Come on in, Terrence. Another military guy here. And Terrence, who are you with?
Sergeant Mitchell with the 852nd Minimal Care Detachment.
Good enough. So Tony's going over his medic bag with us. I'm going to do a little YouTube video. We just did some suturing.
Nice.
How long did we suture for?
About an hour.
Hour. He's ready to.
This was just going over some stuff that I wanted to, get some refresher on a lot of stuff and everything. So
He's ready to rock and roll.
yeah, I'll try, do my best.
I think. Now, was that bag with you all the time?
This bag was with me all the time. Not when I was with the Navy, though. I had what they called the Unit 3, which was a
different
small little trifold medic bag.
Now, whose bag is that? What is the company?
The company that makes this bag is London Bridge Trading Company,
Okay.
and these are awesome bags. These are their the first ones they came out with, called their Spec Ops bags.
And is it set up specifically as a medical bag or just a multi-use bag?
It's set up specifically as a medic bag.
Okay, good.
Because with this comes two little other cases. One with a red handle is marked for your meds that you would have to dispense, i.e. your lidocaine,
Whatever you're authorized to
whatever
use.
you're authorized to
Yeah.
carry, okay?
Okay.
And then the other one has a blue handle on it, and that's for your airway. And you can put your laryngoscopes in there and your ET tubes and everything like that.
And they nest inside there?
They come inside this,
Okay.
but inside this specific bag, I try to just make my bag as lightweight, but have enough stuff with me for what I'm going to need.
So gear management is sort of individual at some degree.
Exactly. And with the gear they're coming out with that we have to wear into the field now, they have adapted for the medics. They've adapted a little. It's called the Molly system, and you have a little. Each person on their chest rig that they wear will have a first aid pouch, okay, and it's identified by a little tab on the top, okay, and it has in it, you have your blood stoppers.
It's like a blowout kit.
It's like a blowout kit, yeah.
Yeah.
It would be an immediate go-to kit
Right.
when you first.
And
get
in
the
general, as a medic, if you're going to help someone, you're going to use their onboard blowout kit before you dig into your gear,
Exactly.
right?
Mhm.
Okay.
And
So everybody's carrying medical.
Everybody's carrying some sense of medical stuff on.
Well, give us a tour. This is a cool looking
Sure.
bag. So what's on the outside here?
The outside here is just the outside compartment.
I saw you have some pockets first. I'm just going to guide you a little bit.
Oh yeah.
What do you got down below there? You got
This
your
I have my
scissors?
trauma scissors here,
Yep.
and I have a carabiner and a
Ears.
little ear protection clip to this.
Yep.
And then on the other side over here, I have another carabiner.
Yep.
And if we had somebody that had O2 and they needed a key, I carry an extra key with me,
Gotcha.
O2 key. So also these little straps that are snapping down here,
Yep.
you can also jump with this bag. And this is
You'd wear that on the front?
formatted for you to jump.
Okay.
If you have to do any parachute ops and stuff. In here is like I carry all this stuff that I have in here. I've kind of like
Wow.
accumulated over the years. And stuff.
You're talking to a bag man, so I'm digging.
And,
I'm digging.
I
this.
have my Israeli dressings.
Yeah.
I have I believe these are my 4-inch. You have 6-inch for bigger wounds, 4-inch for like your minimal arm wounds or lower leg wounds
Yep.
and stuff. I have some cravats over here. And what I mean by cravats are like another quick use bandage.
Okay.
They can also be improvised into a sling. Okay. Flashlight.
What do you got for a flashlight?
This is just a little LED light that I have.
Yeah.
And
Nice.
but I also carry on. You can get these at the store for anywhere from $25 to $40 some.
It's amazing how expensive flashlights are.
Exactly. And then I also have in here, I have some Curlex gauze and some individual sizes in Ace wraps and stuff.
Nice.
And the Ace wraps are good.
You have a
for
nice
setup of instruments here.
there,
I've
yeah.
got like clamps, needle nose forceps and everything like that. Bunch of scissors, different sizes, iris scissors and everything.
cool. Some nice finger splints.
Finger
there.
splints and everything here. Over here I have.
This is a nice bag.
Oh, I love this bag. And it's like I have some more Curlex here, a bunch more cravats because you can never have too many
Never
of
have
those.
too many, yeah.
Yeah, never too many of anything actually. So, and then here, this is.
You're always going to be out of what you need the most.
This is a cricoid kit.
Yep.
Okay. And I've had that with me.
That's a nice one. Whose is that?
That is, I believe, Smith's.
Okay. Emergency cricothyrotomy kit. Nice.
And then these are the famous Hemicon bandages,
Yep.
okay, which were actually
Developed here?
by a doctor here at this hospital and a doctor up at OHSU.
Yep.
And one of the best hospitals around as far as I'm concerned. Been with them for 8 years. Also had the pleasure of working with Dr. Pruitt, who's on the other end of the camera there. He is a former Navy man such as myself, and we bumped into one another, recognized one another when he came to work. Yeah,
Exactly.
But-
so these are nice.
These are nice. Yeah, this is the first size that they came out with.
And the ambulance
4x4.
crews use those
They do.
around here.
They
Yeah.
do, and it's like work great.
So you got a fair amount in there.
I also have Asherman chest seals
Okay.
for any chest trauma.
So this is one of many
Different
commercial chest seals.
that have come out, and the problem with chest seals, the problem with these is like you have a person that's got a sucking chest wound, okay, and for those people that don't know what a sucking chest wound is when you have a penetration wound to your upper torso, that i.e. within the lung cavity, and it punctures your lung, allowing air to get into that space, okay, and by that it creates what's called a pneumothorax, all right, and it will compress what's left of that lung into the other side, okay, making it virtually your breathing is labored, okay. So what we do with these chest seals is you want to place them over the site of the wound, okay, but before you do, you ask the patient to breathe in and then breathe out. Breathe in as much as they can, even though it's going to hurt, and then breathe out, exhale out all the air they can, and then slap it on and just like get it in place. What it does is it creates a vacuum seal to the chest, not allowing air to get in, but it allows the air to escape on inhalation. Okay.
Good enough.
But with these, so you run the problem. It's like you're out there running operations. A guy goes down, you're going to be sweaty because you got all this gear on. You want to make sure
Sweaty
as you're
chest.
putting this on, sweaty chest, you have a dry area, so it's going to stick. Okay. Another method for, if you don't mind me getting into this, is see the plastic seal on this?
Yep.
Okay. You take the plastic seal off, slap it over the wound. Okay. You tape down 3 sides, leaving the 4th side open to act as a flutter valve.
Right. So you're doing a field expedient.
Exactly. You're doing
flutter valve by using your packaging and taping 3 sides down.
And on these chest seals, you have a flutter valve. It's like a little, looks like a little piece to a rubber balloon. It's just a little, what you could call a tiny Penrose drain.
Yep.
Okay.
So I think inside every medic or corpsman there's a little MacGyver.
Exactly.
Do you agree?
I agree.
Yeah.
It's like you come up.
You got to know how to improvise.
You will come up on your fellow medics and stuff like this, and you look at and what they've done, and you're going, wow, that's awesome.
Right.
I'm going to write that down.
Right.
Stuff like
And
that.
you guys are always good about sharing.
Exactly.
Yeah.
But that's this compartment, and I'll open
Your
it.
main concern are your soldiers.
My main concern is my soldiers. I've been doing this for about 19 years, and I love my job. And that's, I'm all about Joe. So
All right. Let's see what you got there.
within this stuff, I just got.
Now we're in the
This is the main compartment of the bag.
Okay.
This main compartment here, was when these bags come to us brand new, where I told you get those other 2 little bags for airway and your medications.
Yeah.
And they can fit right in here, in either pocket. Okay.
Okay.
So what I do is I streamline my bag, and I'll take out this. Up here I've got some extra bandages. I've got some of this H&H compressed gauze.
Yeah.
Okay, for bandaging. Field compress, camouflage. Okay. And I've got some. I also have a panel, marker panel, aviation marker.
Yeah. So if you need to evac someone.
If we need to evac somebody and we set up a casualty collecting point, we can throw this out and they'll ask us what is the method of marking site. You can either use smoke, flares, or you can
marker panel
or a marker panel.
Sweet.
So a lot of us carry these on us and stuff. 4x4s up in here. I've got hand cleaning Purell.
McGill forceps.
McGill forceps.
Yeah.
We are all issued these, and these are for
airway.
Airway only. If you can see something in the airway and you can get at it, like with how they teach you in a CPR, is when you're doing a finger sweep, don't do a blind finger sweep. If you can see the object.
So you're not going to use that McGill unless you can see what you're grabbing.
Exactly. Unless you can see what you're grabbing. I even have my own little field medical suture case.
Nice.
Set up with everything I would need. Your little pockets here. You could put your sutures in here. And everything. So everything I would need to go.
And you definitely have the suturing skills.
Thanks to Hair Doctor here. In this lower portion, I've set up my IV bags.
Okay.
I carry 500 mils right now. You can carry 1,000 mils in this bag.
So now, just to reiterate, this is one. If you need to start an IV, you've got this. You've got this package ready to go.
Packaged up. I got at least 2 18-gauge needles. I have the IV starter kit. I've got 2 alcohol pads, 4x4 or 2x2s, couple 2x2s, and then my IV line.
Gotcha. And I noticed you got a SAM splint.
Got SAM splints in here. Love these. Got a couple of these. I also have my gloves in here.
Yep.
And
you use gloves all the time, right?
Gloves all the time. Up here, I have some more IV stuff. A couple more IV setups here. I got some more SAM splints.
Welch Allen.
I have this is my very own
that's a nice
otoscope,
one.
ophthalmoscope that was given to me by my PA. He gave all the medics one.
That's nice.
I've got my little sphygmomanometer. Blood pressure cuff.
Blood pressure cuff. Yeah.
For those of us that are not in the medical field.
It's a nice bag.
I love it. I love it. I carry collected whatever.
You got your.
I've got Marcaine. I've got lidocaine with epi. I've got regular lidocaine. I've also got some sodium bicarbonate. A lot of you people, what do you use?
Buffer.
So it doesn't. So the lidocaine doesn't sting so much for a lot of people.
Excellent.
I've got some sutures in here.
What do you got right here?
These are. I got to get these out of here. These are expired. But these were. This is Toradol, and then Phenergan.
Well, I tell you, if you're nauseated, that's incapacitating. That's nice to have.
It is. It knocks you out. And then Toradol for pain. You can use Toradol for a number of things. You know, where I keep my scalpels, my extra needles I would need, any alcohol pads. Also have some, what else? More bandages. I have some op sites. And those are primarily used for when you do an IV, you put it over the IV placement so you can keep an eye on your site to make sure nothing happens to it. And that's it in a nutshell what I have in this bag. So
nice job. That's a very nice bag, and you've got it set up really smartly. Okay, so this is a totally cool bag, and the good sergeant is remembering another feature here that he wanted to share. And
on the inside of this bag, as you open it up, I can actually open it up and show you. So you have some more little pockets on the inside here that come in handy for stuff. And I always forget about these pockets. But
medics are kind of bag guys, aren't they?
They are. So you have 2 pockets here, okay? And I've got a bunch of moleskin in this pocket, okay? But you can also utilize these pockets for your
Water bladder?
your water bladder, and when
You've got an outfeed port?
you have an outfeed port right here where you can bring up your hose
Okay,
and everything
cool.
like that. So you can
that's
just
well thought
let it
out.
dangle out of over here. But yeah, you can use them for anything. It's like you can stuff your casualty blankets, the reflective.
And again, Tony, that bag is, the company
The
is,
company is London Bridge Trading.
and the name of the bag?
This is called the Spec Ops bag.
Okay, and you like it as a medic bag?
I love it as a medic bag, and
And do very many of your colleagues use that same bag?
yes, I have quite a few friends that are medics, and they use the same bag, and we're issued the same bag, such as myself.
The other bag that you've seen?
The other bags that I've seen have been the Stomp 2 by Blackhawk.
And your unit is?
My unit is the 3rd Battalion, 116th Cavalry,
Okay.
and getting ready to deploy.
You guys are in your workups right
We're
now?
in our workups right now. I'll be gone as of the 16th of August, and starting our workups, and then come home for a while, be with the family, then we go back.
And
start
what
to-
what is your deployment, roughly, the time frame is you're
Time
back
frame for our deployment is going to be a year.
a year?
And it's not going to be a year when we hit country. All this training that we're doing, actually the training starting in Camp Shelby, Mississippi, starts is our mode.
Okay.
Our mode training. So all that training we do prior to going over into theater counts on our timetable.
Gotcha. Well, thank you for your service, Tony.
Thank you, sir.
We
Thank you.
appreciate it.
You're welcome.
Now, you had one more little tip that you were saying when you're loading that gear up.
On your bag, it's like, I've had my medics come to me and they say, well, what are all supposed to go in these? I said, listen, you load them up so they're comfortable for you. If
Okay.
a lot of you guys have trouble remembering where you put stuff, I will tell you to label it. Label each pouch, tape it to the outside. IV setups, bandaging material, suture material, whatever you want to set it up to be.
So you know where to grab it.
So as soon as you open it up, you know what pocket you need to go to. You go to that pocket, grab the stuff, and you're good to go.
Good enough. Add that to your gear, my friend. Grab it.
Sir, I
I'm
can't
serious.
take this.
Nope. It's my way of saying thank you to you, seriously. And you put that in your bag and put it to good use.
Thank you
Okay.
very much, sir. I will. Thank you.
Be safe.
I will. I will be safe. Thank you.